Understanding the natural progression of life includes recognizing when the body begins to prepare for its final transition. While discussing end-of-life signs can be uncomfortable, having this knowledge can be incredibly valuable. It allows families to make meaningful preparations, have important conversations, and ensure their loved ones receive appropriate care during their final days. Today, we're discussing 3 scientifically validated signs that medical researchers and hospice professionals have identified as indicators that the body may be approaching its natural end. This information isn't meant to alarm you, but to provide insight into the body's natural processes. Before we begin, I want to emphasize that this video is for educational purposes only. Individual circumstances vary greatly, and many of these signs can also occur with treatable conditions. Always consult with healthcare providers for proper diagnosis and guidance related to your specific situation or that of a loved one. With that understanding, let's explore these 3 significant physical signs that often precede life's natural conclusion. Sign number 1, significant changes in breathing patterns. The first and perhaps most recognizable sign involves distinctive changes in breathing patterns. Medical research published in the Journal of Palliative Medicine has documented that approximately 70 to 90% of individuals experience notable breathing alterations in their final weeks and days. The Cheney-Stokes breathing pattern. One specific breathing pattern, known as Cheney-Stokes respiration, has been well documented in medical literature as a significant indicator of approaching end of life. This pattern is characterized by a rhythmic waxing and waning of breathing, periods of deep, rapid breaths, followed by progressively shallower breaths, and then a temporary cessation of breathing, apnea, that can last from a few seconds to a minute before the cycle begins again. Dr. Margaret Campbell, a respected researcher in end-of-life respiratory patterns at Wayne State University, found that this distinctive breathing pattern often appears when the body's regulatory systems begin to lose their normal function. Her research demonstrated that these breathing changes occur because the respiratory center in the brain becomes increasingly sensitive to carbon dioxide levels, while simultaneously experiencing decreased overall function. Other respiratory changes beyond Cheney-Stokes respiration, other breathing changes have been scientifically documented as potential indicators, including irregular breathing, unpredictable patterns with no discernible rhythm, prolonged periods of apnea, breathing pauses lasting longer than 20 to 30 seconds, noisy or wet breathing, often called the death rattle. This occurs when the person can no longer clear secretions from the throat and airways. A comprehensive study published in the New England Journal of Medicine that followed over 200 terminally ill patients found that noticeable changes in breathing patterns were present in 78% of cases during the final 48 hours of life. What this means physiologically: these breathing changes are not random occurrences, but reflect specific physiological processes. As the body prepares for its natural end, several systems begin to change. Decreased circulation affects the brainstem's respiratory center. Metabolic changes alter the body's oxygen requirements. The autonomic nervous system, which regulates involuntary functions, including breathing, begins to function less effectively. It's important to note that while these breathing patterns often signal the body's natural end-of-life process, they are not necessarily uncomfortable for the person experiencing them. Research has consistently shown that perceptions of respiratory distress are often greater among observers than in the patients themselves. Sign number 2, significant changes in skin appearance and temperature. The second major sign involves noticeable changes in skin color, texture, and temperature. These changes have been extensively documented in medical literature and are related to fundamental shifts in circulation and organ function. Mottled skin appearance. A distinctive skin pattern known as mottling has been recognized by medical professionals as a significant indicator of approaching end of life. Mottling appears as patches of purplish or bluish discoloration, typically beginning on the feet and hands, peripheral mottling, and sometimes progressing up the legs, arms, and trunk, central mottling. Research published in the American Journal of Hospice and Palliative Medicine found that mottling, particularly when it extends beyond the extremities, was associated with shorter survival times. A 2014 study of 693 patients found that once mottling reached the knees, median survival time was approximately 10 hours. This finding has been replicated in multiple clinical settings. Temperature changes. Accompanying these skin color changes, researchers have documented consistent temperature alterations in the body's extremities. A study published in BMC Palliative Care found that peripheral cooling, cool extremities, was present in 82.3% of patients in their final 48 hours. The cooling typically progressed from the extremities inward. These temperature changes reflected decreasing peripheral circulation as the body redirected limited blood flow to vital organs. Dr. David Hui, a prominent researcher in end-of-life care at MD Anderson Cancer Center, found that while various end-of-life signs can be unpredictable, skin changes, including mottling and cooling of extremities, were among the most consistent and observable indicators across different disease states. Physiological basis. These skin changes are not simply cosmetic, but reflect fundamental physiological processes. Decreased cardiac output leads to reduced peripheral circulation. Blood vessels constrict in extremities to preserve blood flow to vital organs. Organ failure, particularly of the liver and kidneys, can result in buildup of substances that affect skin coloration. Reduced oxygenation of tissues causes the characteristic blue-purple discoloration. Medical research has established that these changes are part of the body's natural process when approaching its end, rather than something to be treated or reversed when occurring in the context of expected end of life. If you're finding this information valuable, please take a moment to subscribe to our channel and hit the notification bell. We regularly share evidence-based health information that can help you understand your body and make informed decisions. Your support enables us to continue providing this important content. Sign number 3, pronounced decrease in food and fluid intake. The third significant sign is a marked reduction in interest in food and fluids, often accompanied by difficulty swallowing. This natural process, sometimes called anorexia of dying, has been well documented in medical literature as part of the body's natural end-of-life process. The progressive nature of appetite decline research, published in the Journal of Pain and Symptom Management, has shown that decreased oral intake follows a relatively predictable pattern in the final weeks and days of life. Initial decline in the interest in meat and protein-rich foods, progressive reduction in overall food intake, preference shifting to soft foods and liquids. Eventually, minimal to no interest in even favorite foods or beverages. A comprehensive study from St. Christopher's Hospice in London that followed over 400 patients found that 86% experienced significant reduction in oral intake during their final week of life. Importantly, this decreased intake appears to be regulated by the body's natural processes rather than simply being a consequence of other symptoms. Physiological changes in swallowing. Beyond reduced appetite, changes in the ability to swallow, dysphagia, often emerge. Research from the American Academy of Hospice and Palliative Medicine has documented that weakening of throat muscles affects the swallowing mechanism. Decreased saliva production makes swallowing more difficult. Reduced level of consciousness affects the coordination required for safe swallowing, the gag, and cough reflexes that protect the airway become less effective. These changes in swallowing function have been observed across multiple studies and appear to be part of the body's natural end-of-life process, regardless of the underlying condition. The body's natural wisdom. What many find it surprising is that this reduced intake appears to be part of the body's natural preparation process and may actually increase comfort. Dr. Daniel Solmesy, a physician and bioethicist at Georgetown University, notes that research has consistently shown that forced feeding or hydration at end of life does not improve comfort and may actually increase distress. Multiple studies, including a landmark paper in the New England Journal of Medicine, have documented that reduced intake triggers ketosis, which has a natural analgesic and mild euphoric effect. Dehydration reduces pulmonary secretions, potentially easing breathing. Lower fluid volume decreases the burden on the failing cardiovascular system. Endorphin release increases as part of the body's response to reduced intake. This research helps explain why patients rarely report hunger or thirst during this natural decrease in intake, even when they go days with minimal consumption. Important distinction from treatable conditions. It's crucial to emphasize that decreased appetite and swallowing difficulties can also occur with many treatable conditions. The distinction lies in the context and progression of symptoms. When these changes occur as part of an expected end-of-life trajectory, they differ from sudden onset appetite loss, which may indicate infection or other acute illness, difficulty swallowing that occurs in isolation without other end-of-life indicators, dehydration due to excessive fluid loss, as in diarrhea or vomiting. This is why proper medical evaluation is essential to distinguish between natural end-of-life processes and treatable conditions that may present similarly. The convergence of signs and timeframes. Medical research has found that while individual signs may appear in various conditions, it is the combination and progression of these three signs that provides the strongest indication of approaching end of life. A landmark study published in the Archives of Internal Medicine that analyzed data from over 1,000 hospice patients found that when all three signs were present, breathing changes, skin mottling extending beyond extremities, and near complete cessation of oral intake, median survival time was approximately 2 to 3 days. This convergence of signs appears consistent across different underlying conditions. Whether the primary diagnosis was cancer, end-stage heart disease, pulmonary disease, or neurological conditions, these physical changes followed similar patterns in the final days. Dr. Joanne Lynn, a pioneering researcher in end-of-life care, has emphasized that while the timing can vary somewhat among individuals, the sequence of these changes remains remarkably consistent. This understanding has helped hospice professionals provide more accurate guidance to families about what to expect and when. What these signs mean for caregivers and loved ones. Understanding these signs can be tremendously valuable for several reasons. Informed preparation. Recognizing these changes allows families to make necessary arrangements and ensure appropriate care is in place. Emotional readiness. When families understand these physical changes as part of a natural process, it can reduce fear and anxiety about what they're observing. Opportunity for closure. Recognition of these signs provides the chance for meaningful final interactions, completion of important conversations, and gathering of loved ones. Appropriate interventions. Understanding the natural process helps avoid unnecessary or uncomfortable medical interventions that may not align with the person's wishes. Research published in the Journal of Palliative Medicine has shown that families who received education about these natural end-of-life processes reported significantly better bereavement outcomes and fewer regrets about the final days with their loved ones. While this information is based on well-established medical research, it's crucial to emphasize that this video is educational only and not intended as a substitute for professional medical advice, diagnosis, or treatment. Every individual situation is unique, and many of these signs can also appear in potentially treatable conditions. Always consult with qualified healthcare providers regarding any medical questions or conditions. Never disregard professional medical advice or delay seeking it because of something you have heard in this video. If you or someone you care for is experiencing these or other concerning symptoms, please consult with healthcare providers who can evaluate the specific situation and provide appropriate guidance. Conclusion: knowledge as comfort. Understanding the body's natural processes at the end of life can transform what might otherwise be frightening or mysterious into something recognizable and even meaningful. This knowledge doesn't make the experience of losing someone less sad, but it can make it less frightening and confusing. As the renowned palliative care physician, Dr. Ira Byock, writes, "The end of life may be filled with mystery, but we need not be mystified by the physical changes that occur. The signs we've discussed today, changes in breathing patterns, skin appearance, and food and fluid intake, are part of the body's ancient wisdom in navigating its final transition. For those who may be observing these changes in a loved one, remember that your presence itself is the most meaningful intervention you can offer. Research has shown that hearing is often preserved even when other faculties diminish. So continue speaking gently to your loved ones, expressing what matters most. If you found this information valuable, please subscribe to our channel and share this video with others who might benefit from this knowledge. Understanding these natural processes helps us approach one of life's most challenging transitions with greater wisdom and peace. Thank you for your attention to this important but often overlooked aspect of human experience. By bringing these conversations into the light, we help everyone face this universal journey with greater knowledge and compassion.